Hi, my name is Rena DeSasia, and I'm an assistant professor of emergency medicine here at the University of California in San Francisco. I'd like to talk to you today about a study that we did recently examining the question, how often do patients return to the emergency department, and what are the costs associated with those revisits? We found that the rate of return to the emergency department was much higher than previously thought. We used data from the Healthcare Cost and Utilization Project over 5 years in 6 states and found that within 3 days, nearly 1 in 12 patients returned back to the emergency department, and nearly 1 in 5 patients returned to the emergency department within 30 days. Among those revisits that occurred within 3 days, we found that nearly 1 in 3 patients went to a different emergency department from their initial ED visit. When looking at cost, we used the state of Florida, the state that had the most accurate cost capture, and we found also that the total revisit costs were higher than the total index visit costs within 30 days. I became interested in studying this question because as an emergency physician, I would often see patients coming back to our emergency department after an initial visit. I also have practiced in several health systems and knew those rates of return really would vary depending on where a patient would present. This study is the first step in understanding how often patients return to the emergency department at the population level. In addition, because we saw variation across conditions, it provides a direction in how we can develop benchmarks around these revisit rates. The finding that I found most surprising when examining our data was that nearly 1/3 of our visits returned to another emergency department from their initial ED visit. This is important because solely focusing on return visits to the same emergency department would have missed nearly 1.5 million revisits. The policy implications of our study are several. Because we found that the scope of revisits are much higher than previously thought and that 1/3 of our revisits occur at different institutions, we should really improve the communication infrastructure across emergency departments and hospitals. As ED providers, having real-time access to these medical records would improve the care that we provide to our patients and help improve the fragmentation of care and the duplication of tests. In addition, another policy implication is that we have conditions that occur more frequently to the emergency department. By focusing on developing benchmarks around these conditions that are more frequent or have higher costs to our health system, we can develop effective interventions that can improve the care we deliver to these patients. I encourage you to read our paper, and please feel free to contact me if you have any questions or comments at rena.desasia@ucsf.edu. Thank you.